If you've ever taken medication to manage your bipolar symptoms, chances are you've probably experienced some unwanted side effects. I know that I sure have, and to be frank, they can be pretty terrible. Today I wanted to talk about one particular side effect that can carry some shame and even embarrassment for some folks. I'm talking about the lowering of the libido, in other words, the lowering of the sex drive. For me, this has tended to happen while taking certain antipsychotics that are prescribed as mood stabilizers. One particular one that caused this for me was Latuda. If I was single when this happened, yes, it would have been embarrassing if an opportunity presented itself where the sexual attraction between me and someone else was there, the opportunity to have sex presented itself, and I just had no desire to do it. However, when I experienced this, I was in a serious and long-term relationship, and it definitely caused some damages. One reason is because whenever my girlfriend wanted to have sex and connect with me in that way, I almost always turned her down, saying that I just didn't feel like it. On the surface, yes, the rejection was one thing, but underneath the surface is where insecurities started to develop. My girlfriend would question whether or not it was something that she was doing to turn me off. She would question whether or not I was even sexually attracted to her. And in some cases, she would even question whether or not I was either attracted to or having sex with someone else. I tried my best to explain to her that yes, I was sexually attracted to her and that no, I was not cheating on her with anyone else. But eventually, this kind of became a thing in our relationship. It was an ongoing hurdle that we had to face. Over time, it made me feel embarrassed. It made me feel like something was wrong with me. Long story short, I spoke to my doctor and asked him if I could switch to an alternative medication. And over time, my sex drive returned and we were in a much better place because of it. Now, I'm not trying to say that anyone who takes Latuda or any bipolar meds is going to experience this. However, what I am saying is that after speaking to a lot of people with bipolar disorder, this is a very common side effect for a lot of us. If this is something that you've been struggling with, I first want you to know that you're not alone. Unfortunately, this is something that a lot of us have dealt with. But I would encourage you to speak to your doctor and they may be able to find an alternative medicine that works better for you. Thank you for tuning in to Bipolar with B. Russ. If you found this video valuable, please like and subscribe to the channel. It would help out a whole lot and mean a lot to me. Take care of yourself, and I'll see you next time. Peace.